Good morning, everyone, and welcome back to Failing is Not an Option YouTube channel where we are all things marriage and family therapy, not just for the MFT national exam, but we can also use a lot of this information to apply it with our families that we work with in therapy, whether it's individuals, couples, family, groups, whatever the case may be. But we are still all things family therapy. And just like I said, each week I was going to be releasing a weekly question review from the questions that we work on in the Failing is Not an Option Facebook group. I have some followers that are not on Facebook, so this is their way of also having eyes in the Facebook group, even though they do not. So without further ado, let's dive in and look at some of these questions. I pulled some of these questions from, I want to say maybe 3 weeks, 4 weeks ago, and I just compiled them. These are some of the questions that I saw a lot of people had different answers for, and they were coming up with different rationales. So it's best if we work through them together and hear my voice as we go over them, okay? Now, this first question. A therapist is working with a family of 4, 2 parents, 2 teenage children. The presenting issue is the younger son's declining school performance and irritability. The parents report frequent arguments at home and accuse the older sibling of being too soft on the younger one. The older sibling says, "I'm just trying to keep the peace." The therapist observes that the younger son often looks to the older sibling before answering. Which of the following hypothesis is most supported by this information? So now, this question is asking you for your hypothesis. What do you believe the therapist's best way of looking at what is really going on with this family? But before we look at those answer responses, take a look back at that vignette and highlight what sticks out to you, because that's going to help you find the best answer. We got the younger sons is declining in school performance. We have the parents arguing, saying that the older sibling is being too soft on the younger sibling. So that right there tells me that there's some hierarchies or something that's off, because why are the parents telling the older sibling that he's too soft on the younger one? Isn't that a parent's role, right? So then the older sibling says he wants to keep the peace. The younger son looks to the older sibling before he answers any questions, even though the parents are sitting right there in the room. Let's take a look at some of these answer responses. A says the older sibling is triangulated between the parents and the younger child. I like the way that sounds, but let's take a look at the rest of them. B says the younger son is struggling with identity formation. My issue with B is none of that is mentioned in the vignette. Don't add to the vignette. Don't be looking for it in the vignette. Even if an answer response like, oh, that answer response sounds good. It might sound good, but it's probably not the best answer. Make sure that you are looking at the best answer. C says that the parents have authoritarian parenting style. How? The parent is telling the older son that he's too soft on the younger one. Who has the upper hand? Not the parents. You would get rid of C. D says the older sibling is enabling the younger sibling's poor behavior. How? And this is your distractor, because the older son is saying, I'm just trying to keep the peace, and maybe that is trying to enable the younger sibling's poor behavior, but it's not the job of the older sibling to be managing the younger son, his little brother's behaviors. That's the parent's job. So if we take a look at A, the older sibling is triangulated between the parents and the younger child. He most definitely is. And there's also some hierarchies that are off, right? Because the older sibling is telling the younger sibling what to do, managing his behaviors, while the parents are yelling at the older sibling because he's not doing what he's supposed to do in order to manage the younger sibling. No, that's not how it works. Hierarchies are off. He's being triangulated between the parents and the younger child. Tug and pull. He's being pulled in with the fighting with the parents and everything. The younger child is looking for the older brother to tell him what to do. He's being drawn in. No, can't work that way. A is your best answer. Alrighty, pause this video, see if you can find the best answer before I do. A 34-year-old begins therapy 2 weeks after witnessing a violent robbery at her workplace. Oh my God. Since the event, she reports feeling emotionally numb, having trouble sleeping, reoccurring intrusive images of the robbery, and avoid going near the store. She startles easily and feels constantly on edge. She has no prior psychiatric history. Her symptoms have been present for 12 days. This is one of your classic diagnosis questions. So the question is, what is the most appropriate diagnosis? When it says the most appropriate, it has to be the one that clearly matches the symptoms that are being presented in the vignette. Take a look back at the vignette, because I believe even reading this, we've got some trauma symptoms that are going on, right? We have all of that: trouble sleeping, startled, she's avoiding going back, intrusive images, emotionally numb. So we've got some trauma symptoms. But we also need to pay attention to, there's a number here. There's a certain amount of days that we also need to be paying attention to, and it's 12. So look at the answer responses. A says post-traumatic stress disorder. My issue with post-traumatic stress disorder is we've got some trauma symptoms in there that could lead us to PTSD, but the time frame is too short. We got to get rid of it. PTSD is how long? 1 month. 12 days is being presented. B says adjustment disorder with anxiety. The issue with B is that there is no identifiable stressor that has occurred. An identifiable stressor needs to be what? Loss of job, divorce, getting married, having your first baby. That is your identifiable stressor, but there isn't one here because it's more like a traumatic event that has occurred. Get rid of B. C says acute stress disorder. I like C, but take a look at D. Generalized anxiety disorder. If you're going to choose an answer response that says generalized anxiety disorder, it must say something about excessive worrying for most of the days. D is incorrect, leaving C being the best answer. Acute stress disorder. We have 12 days that is listed with trauma symptoms. But because the time frame is not more than 1 month, it can't be PTSD. That is the difference between PTSD and ASD, acute stress disorder. Good job, everybody. A therapist is conducting an intake session with a new client who reports feeling disconnected and lacking meaning in life since retiring. The client mentions occasionally attending religious services but doesn't elaborate. Based on best practices for integrating spirituality into therapy, the therapist should do what? This is one of your questions where it's like, you need to know how to integrate certain practices into your client's goals or however it is they want to work on therapy, right? And this is your intake session. So keep that in mind. This is an issue. This is the first time that you are meeting this client, right? So you want to choose an answer response that's going to pave the way for like, this is my first time meeting this client. How am I going to integrate spirituality into therapy with this client? The client reports feeling disconnected, lacking meaning in life. The client has retired. And they attend religious services, but they don't elaborate on it. Okay? Now, A says, assume the client's religious attendance is purely social and focus on other coping strategies. My issue with A is that you are ignoring that this client has began to discuss religious practices, anything spirituality. Why should we ignore that? You don't know if that is really actually helping this client cope with retiring. Even though they said they lack meaning, they possibly could use that to cope with retiring, okay? B says, explore the role of spirituality or faith in the client's life as part of the assessment. I like B, but let's take a look at the others. C says, avoid discussing spirituality unless the client initiates the topic in detail. My issue with C is that they mentioned it. They've already brought it up. Why are you going to avoid discussing it? They just didn't elaborate on it. It's nothing wrong with you just like, hey, do you want to explore this area? Right? D says, refer the client to a spiritual leader for further exploration of meaning and purpose. My issue with D is you just met this client, so now you're just going to give them up before even trying. It's steps you take before you're even going to refer a client out. You just don't do it. You're just getting rid of the client. You just met him. He's already saying that he feels disconnected and he's lacking meaning in life since retiring. So that tells me, is he depressed? Do I need to be assessing him? Right? Take a look at B. Explore the role of spirituality or faith in the client's life as part of the assessment. Remember, this was your intake session. Assessment is that word that you were looking for. Explore also. When it comes to like cultural questions such as spirituality, religion, any of those kind of questions, exploring because you want to be curious. And then if the client tells you, hey, I don't want to talk about that, then you don't have to talk about it. But this is your first question. This is your first session. It's an intake session. Assessment is that word that you were looking for because it's the first time that you're meeting them and you want to assess what's going on with them and what it is that they need to work on. Okay? I hope that makes sense. Oh, this is a long one. A licensed marriage and family therapist receives a subpoena requesting their testimony and treatment records related to a high-conflict divorce and custody case involving a former couple client. The therapist previously worked with the couple jointly, and individual confidentiality agreements were not established. One party has since contracted the therapist, requesting that no information be released, citing concerns that disclosure could unfairly impact the custody decision. The therapist is also aware that revealing session content could potentially harm the therapeutic alliance if either party returns to therapy later. Okay, we got a lot going on in this vignette. So the question is, what is the therapist's most appropriate next step? Okay, this is the next step. This has to be appropriate. This has to be the right one. This has to be ethically, what am I going to do that is going to help this family? Also, ethically and legally, what are you going to do in order to help this family? But let's take a look back at the vignette. You've received a subpoena requesting their testimony, and they want treatment records. The therapist previously worked with the couple jointly. The individual confidentiality agreements were not established. One party contacted the therapist. They don't want their information released, saying that if they do release it, there's going to be an impact on a custody decision. And the therapist is also aware that revealing some of the session content could potentially harm the alliance if they were to return back to therapy later. Okay, this is your ethical, and this is like a legal ethical question. How are you going to navigate this, right? So let's take a look at the answer responses. A says refuse to comply with the subpoena based on client privilege and ethical duty of confidentiality. The issue with A is an entire lie. You do not refuse to comply with any subpoena. You do not ignore a subpoena. Even if you don't know what to do when you get a subpoena, you cannot ignore it. You cannot refuse to comply with it. A is a lie. If you don't know what to do with a subpoena, what do you need to be doing? You need to be contacting some legal consultation, reaching out to some your supervisor for some information. A is a complete lie. Stay away from answer responses that tell you to refuse to comply to a subpoena because it's incorrect. B says contact both former clients to obtain written authorization to release treatment records and provide testimony. The issue with B is the vignette has already stated one of them does not want the information released. Why are you contacting them to get written authorization? They've already told you they don't want the information released in order for the treatment records and to provide testimony. B is incorrect. C says seek legal consultation to determine the appropriate response before taking further action. I like C, but let's take a look at D. D says submit only general session dates and attendance records, omitting sessions content. The issue with D is one of your clients has already said they do not want the information released. So now, before you do anything, you need to be seeking legal consultation. You need to find out what it is that you need to do before you take further action. Do not make any decisions on your own when it comes to subpoenas other than, okay, well, I'm just going to assert privilege until I speak to somebody, right? That's all that you can do. Don't go releasing stuff. Don't go calling somebody. Don't go talking to a lawyer for peace sakes. Please don't do that. Do not refuse to comply. Don't ignore, because that gets you in a lot of trouble. Questions like these, you have to do what? You're always going to think of your well-being of your clients first. Their welfare is important first. If they're saying they don't want the information released, you cannot be doing D. Don't do D's answer response, because one of them said they don't want it. Think of your client's welfare first. Also think of my license. If I make the wrong mistake, if I do something wrong, is my license going to be held liable for this? Protect the client, protect your license. I hope that helps. Okay, now, Maria is a 26-year-old woman who recently began therapy with you. In her third session, Maria tells you that her father sexually assaulted her when she was a teenager. She tells you that she has kept this secret her entire life and does not know if she wants to tell her mother or press charges against her father. Pause this video, see if you can find the best answer before I reveal the best answer. Based on this information, you must. If we go back and take a look at this, the things that we need to highlight in the vignette, we know that this is probably towing the lines of like an ethical decision that we need to be making right now, right? She's 26 years old right now. She's not a kid anymore. She was sexually assaulted when she was a teenager. She doesn't know if she wants to tell her mother or press charges. Those are your specifiers that we want to highlight that is going to lead us to our best answer. A says, explain to Maria that as a mandated reporter of child abuse, you must file a report. The issue with A is that is a lie because Maria is 26 years old. She's not a teenager anymore. That happened when she was a teenager. She was sexually assaulted as a teenager. You only file a mandated report for child abuse if it is a child, not a 26-year-old. B says maintain confidentiality. I like B, but let's take a look at the other ones. C says advise Maria on how to legally proceed if she decides to press charges against her father. The issue with C is we don't give advice about legal things. That's outside of our scope of practice. C is incorrect. I don't know how you would even legally proceed, and to tell a client that, absolutely not. D says, explain the statute of limitations to Maria and recommend she obtain legal counsel as soon as possible. Again, C and D are towing the lines with each other. Outside your scope of practice, you shouldn't be teaching any client about the statute of limitations. I don't know the statute of limitations for any crime that is committed. And then you are recommending. Please don't give recommendations when it comes to anything legal. Outside of our scope of practice, that's not for us. If that's the case, then you need to be seeking legal consultation before you are even telling anything to your clients. B says maintain confidentiality. She's 26 years old. She's not a child anymore. You can't report it. So your best ethical thing that you must do is to maintain confidentiality. You may explore some of these things with her, but you're not recommending to her to do anything legally, and you're not telling her that she needs to be pressing charges or advising her to do anything that has to do with legal matters. That is for legal people with legal careers to take care of. You're a marriage and family therapist. Keep that in mind. Okay. A therapist began seeing a family after her 16-year-old daughter, Lila, was hospitalized for cutting herself. The mother is tearful and blames herself, while the father sits with his arms crossed and says, she just wants all of the attention. Lila avoids eye contact and says very little. The therapist mirrors the family's tone and pacing and gently validates each member's concerns without taking sides. From a structural perspective, what is the therapist's primary goal in the early phase of treatment? Okay, alrighty, this is one of these questions that if you don't pay close attention, you probably may choose the wrong answer. But pause this video before I reveal the best answer. See if you can find the best answer before I reveal it. Go back to the vignette, take a look at it. Now, even before we get to the question and they're talking about a structural perspective, I knew it was a structural question because it says the therapist mirrors the family's tones and pacing and gently validates each member's concern without taking sides. Now, it says Lila was hospitalized for cutting herself, and the mother is blaming herself. Dad thinks she just wants the attention. Lila is avoiding eye contact, and the therapist is using a structural therapy approach. What is a therapist's primary goal? This is a goal that you have in the early phase of treatment. It's a goal, okay? Now, A says, diagnose Lila with non-suicidal self-injury. My issue with A is why are we diagnosing her with non-suicidal self-injury? Like, what's the goal? What is that going to do for the family? How is that going to help this family? We need a goal, not a diagnosis, right? It's asking for a goal, not a diagnosis. Keep that in mind. B says establish therapeutic alliance by joining with the family system. I like B, but let's take a look at the others. C says immediately assess for suicidal intent and report if necessary. The issue with C is she's not saying that she's suicidal. They said that she was hospitalized for cutting herself. It didn't mention anything about presently right now she has thoughts of cutting herself. She has thoughts of suicide. She's feeling depressed. She's feeling lonely. She's feeling hopeless. None of that is mentioned. There is no need for you to assess. C and A, let me take a look at D. Encourage Lila to take the responsibility for her actions. Okay, first of all, we're not encouraging our clients to do anything. Obviously, this girl needs help. Okay, so D is automatically out. A, C, and D, no, I won't say D. I'll say A and C, they are your distractors. It's meant to put there to distract you because it is paving way to what's being said in the vignette, right? It's paving way to it, but it's not what the question is asking for. You have to pay attention to what the question is asking for before you give your best response. It says, from a structural perspective, as a structural therapist, what is the primary goal in the early phase of treatment? You know that in the early phase, as a structural therapist, you are doing what? You are joining with the family. B is your best answer. Do not be distracted what's in the vignette as opposed to what that question is asking you for. See, a lot of people got tripped up with this answer because they're looking for like assess for suicidal intent. Nothing about that is in this vignette. And this question is about a structural therapist. It's about her non-suicidal, self-injury things that she's doing, but then it's not. It's about a structural therapist. I hope that makes sense. Okay. During the termination phase with George, he becomes distressed and requests to continue therapy with you instead of terminating. You believe that therapy should be terminated. You should do what? Now, this is your classic termination question. And when you terminate therapy, it can't be just all about what the client wanted, all about what the therapist wants. It has to be collaborative. They go hand in hand. George becomes distressed. He wants to continue therapy, but you think that therapy should be terminated. So let's look at the responses. A says, review the presenting issues and develop a new treatment plan. The issue with A is, developing a new treatment plan is you starting all over again. You're already in the termination phase, so that tells us that, hey, his goals that he's met, and it's time to terminate. But he just becomes distressed during termination. It's okay. It's normal to be anxious. It's normal to be distressed, but you just cannot start all the way over just to keep your client in therapy. B says, reassess the need for termination. I like B, but let's look at the other responses. C says, empathize with his feelings of distress and add some sessions before proceeding with termination. The issue with C is that how is that going to help, because you are in the termination phase. When it comes to termination, you don't have to be adding any more sessions before you proceed with termination. All you have to do is you're going to collaborate with your clients. You're going to find out, explore why are you feeling this distress right now? What do you think that we need to do in order to help? And that's going to sound along the lines of what? Reassessing for termination. D says terminate immediately. First of all, your client just said he was distressed. You cannot terminate when a client is in a crisis, when your client is feeling distressed, right? Especially when it comes to these generalized questions like this. Now, I can see if this was like maybe Milan or something, or because once you get to them 10 sessions, you're done regardless, is what my understanding is. But you are going to reassess the need for termination. Because the vignette says, you believe, but George does not want to. You got to reassess. It's collaborative. Okay? Hope that makes sense. Oh boy, here's another long one. Okay, 6 months ago, Rick and Pat started therapy along with Rick's 11-year-old son, David. They sought therapy to address step-family adjustments. Although the family has been making steady progress towards their established treatment goals, in the last session, Rick informed the therapist that they have decided to end family therapy and have David see his school counselor for individual sessions. What steps should the therapist take in preparing to terminate with this family? Okay, this is your classic termination question. Again, termination needs to be what? It needs to be collaborative. It cannot be all what the client wants, all what the therapist wants. Pause this video, see if you can find the best answer before I reveal the best answer. We're going to tear this question apart. So, you're in therapy 6 months. That tells you already, okay, they've been in therapy for 6 months. Hey, you either got it or you don't. My whole thing, right? Step family adjustments is what they were working on. They've made steady progress towards the established treatment goals. That's your specifier. They've made steady progress. Pay attention to that. In the last session, working from the therapist, they have decided to end family therapy and have David see school counselor for individual sessions. Okay? They've made steady progress. 6 months, they just want to end. Okay? What steps should the therapist take to prepare the family for termination? Okay? They're terminating. There's no reason to keep this family here, right? A says communicate the therapeutic importance of a termination session and schedule 1 or 2 more sessions with the family to review progress and wrap up treatment. Okay, I like the way A sounds, but let's take a look at the rest. B says communicate the therapeutic importance of a termination session. Urge the family to continue services based on progress made and continue to schedule sessions for as long as they are willing. The issue with B is that word urge. I'm not urging my family or my clients to do anything. If you say you're ready, then I'm just going to help you consolidate those gains and get you out the door, right? They don't need to keep going. They've made steady progress. They've been in therapy for 6 months. Damn, how much longer do you want them to stay, right? C says communicate the therapeutic importance of a transition session and schedule the final session to include the school counselor. Now, here it is again. Where are we including the school counselor in this? Right? We need to include the family in the termination session, not just the school counselor. C does not include that. C talking about the school counselor. We need this family. Family is not mentioned in C, so C is incorrect. D says communicate about the closure of their case and document the conversation in the termination note. A termination session is not needed since the child will be continuing therapy with another provider. D is incorrect. Please don't ever say like, oh, termination session is not needed, especially when it comes to these generalized questions like this. This is one of your generalized questions. That's not true. A termination session is not needed. Strategic therapy, Milan, and all of those, maybe, because sometimes the family may not come back. But for questions like these, for just like, if it's not theory specific and it's generalized, that's not true. A termination session is needed because it must be collaborative with the family. Take a look at A. Communicate the therapeutic importance of a termination session, because David said that they just wanted to end. But hey, I want you to come back and let's do a termination session. Schedule 1 to 2 more sessions with the family to review progress and wrap up the treatment. This is the best way that you are going to prepare the family for termination. Now, some of the times you might see a question that tells you do 1 or 2 more sessions or do more sessions indefinitely. That's incorrect. It's not indefinitely because they're ready for termination, right? This is the best answer out of the 4. I get it. Sometimes we are looking for those answers that are just like, well, I'm looking for an answer that says this. It's not going to be there. Out of the 4 responses, there is only one that is the best answer. Walk your way through it, especially when they're long like this, and make sure that it makes sense. Okay. A 16-year-old is brought to treatment for an eating disorder. How would a therapist using a feminist theory therapy view this issue? This is one of your classic, I think, the practice of systemic therapy questions, right? So it's the feminist theory approach that we are thinking about. So our answer response needs to be attached to that feminist theory, right? A says unresolved issues of early childhood can manifest as eating disorders. Feminist theorists do not talk about unresolved issues in early childhood. So we would get rid of A. A is what model? Leave a comment and let me know which model A is talking about. B says her automatic thoughts cause unhealthy body image. Feminist theory do not focus on automatic thoughts, but there's a therapy that does. Which one is it? Leave a comment about it. C says cultural expectations of women negatively affect their sense of self. Okay. I like how C sounds, but let's take a look at D. D says denial of food is a defense mechanism to manage anxiety. D is also another therapy modality. Which one is it? Leave me a comment. C says cultural expectation of women negatively affect their sense of self. This is the best answer response out of the 4 of them because A, B, and D are from all different models. Leave me an answer response for which A, B, and D, which models those are from. And this is how you can easily find the best answer by knowing which terms match which model. Okay, oh boy, another long one. A family seeks therapy because their 12-year-old daughter refuses to go to school. The parents report trying everything, punishments, rewards, and even walking her into her school building. Oh, y'all doing a lot. But nothing has worked. A strategic therapist instructs the parents to allow the daughter to stay home, but only if she agrees to follow a strict homebound student routine, including getting up at 6 a.m., doing schoolwork for 6 hours, and having no access to electronics or social activities. Within a week, the daughter returns to school willingly. The parents later cancel future sessions. How would a strategic therapist most likely interpret this termination? Okay, We're thinking like a strategic therapist. They've done what it is that they need to do. They didn't come back to sessions. She must have been getting up at 6 a.m. doing that schoolwork and didn't like it no more, so she returned back to school within a week, right? A says the family is avoiding deeper emotional issues. Strategic therapist doesn't really focus on all of those deep emotional issues. It's the present, it's right now, it's the behavior interactions, and what are we going to do to change it? Stat, like that. A is out. The family has successfully completed symptom-focused treatment. I like the way that sounds, but let's take a look at the other ones. The therapist moved too quickly to intervention. That's not true, because strategic therapy is brief. It's meant to be quick. I'm going to get you in and I'm going to get you out, right? D says the daughter's behavior change is likely to be temporary. First of all, how you know? The vignette ended with her going back to school, so how you know it's going to be temporary, right? So it leaves us with B. The family has successfully completed symptom-focused treatment. That is what strategic therapy is about. Symptom relief. Once the symptom is relieved, get out of my office. That's how strategic therapy works. Alrighty, last one. Oh my God, we've hit 30 minutes, but that's okay because since I'm not working in a group this week, you get like an extra dose of me throwing a video. A therapist begins working with a family consisting of a mother, father, and their 16-year-old son. The parents report that the son is defiant, skips school, stays out late. During sessions, the therapist observes that the mother and son have an unusually close relationship, while the father remains quiet and disengaged. The therapist begins involving the father more actively in parenting decisions and encourages the mother to step back from the son's personal issues. After several sessions, the son begins attending school more regularly and he's following household rules. The family soon stops attending therapy. Now, go back and take a look at the vignette. We've had a lot of things that this 16-year-old has been doing. The father used to be quiet. The mother used to be like a helicopter parent, involving herself in issues and stuff. But now the son has attended school more often. He's following the household rules, and the family has now stopped attending therapy. How would a structural therapist most likely understand the termination? Termination again, we're thinking termination. A says the therapy successfully realigned the family structure. I like A because it's like a structural therapy response, right? B says the father needs additional individual therapy. How you know that the father needs more individual therapy? It didn't say none of that in the vignette, so get rid of it. C says the son's behavior improved due to increased punishment. No, it didn't. That ain't how structural therapy works, right? It's about realigning of the hierarchies. The parents needed to be right where they were, on the same page. Not the father being quiet and the mother being a helicopter. They need to be on the same page. C is incorrect. D says the mother's over-involvement was not fully resolved. If it wasn't resolved, they would still be in therapy. But they terminated, right? So obviously something was resolved. A is the best answer. The therapy successfully realigned the family structure, right? The mother took a step back from being involved in the son's personal issues, and the father became more actively in the parenting decisions, meaning that the parents are now both here and the son is down at the bottom, right where he belongs. Alrighty, I'm going to end this video. We are at 33 minutes. If you appreciate this 33 minutes, please let me know, because I'm kind of like itching out my skin here. But anyways, yes, if you have any questions, comments, or concerns about these questions, please let me know. I will see you all when I return next week.